This is a step-by-step instructional video on how to obtain thoracic radiographs, including some important considerations for positioning. These principles demonstrated in a canine patient are also relevant for many other mammalian species. Initially start by measuring the width and height of the thorax. This helps to determine your radiographic exposure factors. The width of the thorax determines the exposure factors on a lateral radiograph, and height determines exposure factors for a ventrodorsal or dorsoventral view. Refer to the radiographic technique chart and set the KVP and MAS according to the relevant patient measurements. Next, collimate to the region of interest. In this right lateral view, the perpendicular line, extending in a dorsal to ventral direction, is positioned roughly at the caudal border of the scapula. The cranial aspect of the field of view should extend cranial to the thoracic inlet, with the caudal aspect including the 12th or 13th rib. Remember, the hands of staff involved in patient restraint should be outside of the collimated field of view, also known as primary beam, and appropriate shielding with lead gloves, aprons, thyroid protectors, and/or goggles should be worn by anyone remaining within the room. If possible, positioning devices, such as sandbags or tape, may be used to restrain the patient as an alternative to physical restraint by staff. Make sure that the correct marker, right marker, is in the field of view and is not superimposed over the relevant anatomy. Extend the thoracic limbs cranially and acquire the radiograph during the inspiratory phase. Repeat positioning techniques performed for the right lateral in a left lateral recumbency. The same radiographic technique exposure setting may be used. Ensure the appropriate marker, left marker, is within the field of view and not superimposed over the relevant anatomy. Extend the forelimbs cranially and acquire the radiograph during the inspiratory phase. Positioning for ventrodorsal radiographs is performed with the patient in dorsal recumbency, either in a positioning trough or directly upon the table. The sternum and spine os processes should be aligned with the longitudinal positioning line. Radiographic technique factors should be adjusted for the height measurement of the thoracic cavity. Ensure the marker is in the correct location. As before, staff involved in patient restraint should have appropriate protective equipment including gloves and should not be exposed to the primary beam. Extend the limbs, maintaining straight positioning. Radiographs should be acquired during the inspiratory phase. Dorsoventral radiographs are obtained with the patient in sternal recumbency. The spinous processes are palpated and should align centrally with the longitudinal positioning line. The positioning marker should be placed. Radiographic technique factors are identical to those selected for a ventrodorsal view. Staff involved in patient restraint should wear appropriate protective equipment, including gloves. Following acquisition of each radiograph, the images should be evaluated to ensure good radiographic technique and appropriate positioning. Radiographs with poor radiographic technique or inappropriate positioning should be repeated to maximize utility. Chemical restraint may be required in some circumstances to achieve appropriate positioning. Poor radiographic technique or inappropriate positioning may limit the veterinarian's ability to evaluate certain structures or may lead to misdiagnosis. This is an example of appropriately exposed and positioned thoracic radiographs. Additional videos and information on evaluation of radiographs for appropriate positioning and radiographic technique, as well as evaluation of thoracic structures, will be provided.